Hey everyone, and welcome. I'm Dr. Kara Wada, and I am thrilled to be kicking off a new type of content here on my YouTube channel. Longer format videos where we can really dive into topics that you've told me matter most. For those of you who don't know, hi, I'm board certified in pediatric and adult allergy immunology and also have some training in lifestyle and functional medicine. But I'm also a patient. I have Sjogren's, a systemic autoimmune condition, and I am walking that patient path right alongside you. I am so excited to explore these topics, not just from a physician's perspective, but as a fellow patient who understands these struggles firsthand as well. Today, we're going to be tackling a big one, managing our Sjogren's medications. Now, remember, although I am a physician, I am not your physician, and this content is for educational purposes only. Does dealing with little pills or eye drops and gels and all the things just sometimes feel like it's more hassle and overwhelming than actually helpful? Between side effects and possible drug interactions and expiration dates and long-term side effects and risks, it can be a lot to juggle, and I get it. It's crucial, though, to understand the medications you're taking, why you're taking them, why you should potentially take them, and importantly, how to minimize those potential downsides and get the most of the treatments you are using. That's what we're going to be exploring together today. So let's first dive into our Sjogren's medication toolkit, a toolkit for relief. You can think of your Sjogren's treatment plan as your own personalized toolkit, a collection of strategies and solutions that help you feel your best. Let's explore what's inside. We're going to start with over-the-counter essentials. These are critical, especially in helping alleviate those dryness symptoms that many or most of us with Sjogren's are dealing with. Artificial tears, incredibly helpful. That gritty sandpaper feeling in our eyes that we know all too well with dry eye can be alleviated by giving our eyes a big hug with some artificial tears. They can be soothing, moisturizing, and protect those delicate tissues from ongoing damage. It's important to experiment with different types. You're going to see multiple products that are on the market: drops, gels, ointments. Ointments can be incredibly helpful for nighttime relief. If you are using over-the-counter re-wetting drops more than 4 times a day, it is typically recommended to use a preservative-free formulation. These are going to come in little individual vials as opposed to a multi-use bottle. Those should be replaced every day or 2 if you are using those individual vials. They're not going to last as long because they are preservative-free. The other thing that is really helpful is knowing how to use these drops. If you were using eye drops of any kind, it can be helpful to put 1 drop in each eye and then close your eyes and leave them closed for 2 to 3 minutes for that medication, those eye drops, the re-wetting solutions to do their thing before you go blinking. If you're continuing to blink, you're going to wash that medication away and you won't get its full effects. Oral moisturizers. Dry mouth can make simple things like swallowing or talking quite uncomfortable. These also come in gels and sprays and lozenges, and they can help to keep things feeling more comfortable. They also can help with your dental hygiene as well. Many of these will contain xylitol. There has been some controversy recently over the safety of xylitol, but it's generally thought that the small amount that are in these sprays and lozenges, probably the juice is worth the squeeze, at least in my opinion, in my interpretation of the literature that is out there. Xylitol is considered a high FODMAP or FODMAP containing product. So for some people who have IBS, this can be a trigger for increased symptoms. That tends to be more of a problem the more that you use. So it tends to be a dose-dependent effect. Some of these gels, sprays, or lozenges come in different flavors. If you suffer from burning mouth syndrome, it might be best to steer away from the mint-flavored ones and to try some that are unflavored or other flavors that you tolerate better. Sugar-free gum is another option. Simple, but a surprisingly helpful trick. This also stimulates saliva production. It's simple, it's sustainable, can help combat dry mouth throughout the day. Let's dive into some of the most common prescriptions that a rheumatologist, an immunologist, neurologist might prescribe in the treatment of your Sjogren's disease. These tend to target inflammation and immune response. The first is hydroxychloroquine, and the brand name is called Plaquenil. This is considered a disease-modifying anti-rheumatic drug and is often prescribed for Sjogren's disease, but also for lupus and several other autoimmune conditions. It can help calm down an overactive immune response, but is not considered to be immune suppressive. It does not make patients more susceptible to infections than they would be in not taking the medication. It's generally considered a quite safe medication. It actually originally was used to help prevent or treat malaria. Turns out now it's not as great at treating malaria, but regular eye exams are essential. So you need to let your eye doctor know if you experience any vision changes, any tummy troubles, unusual skin rashes, but generally well tolerated and can help considerably with Sjogren's, fatigue, and potential joint issues and arthritis. Methotrexate is another DMARD, often used to help manage Sjogren's disease symptoms. It is also very commonly used as a first-line treatment for rheumatoid arthritis. It works a bit differently than hydroxychloroquine, and it does cause some immune suppression. Methotrexate can sometimes affect liver function, so regular blood testing is important for monitoring while on this medication. It also can increase fatigue and cause mouth sores, and most often is administered with folic acid to help counteract those symptoms. Methotrexate can be administered orally or through injection, and for those who are having significant stomach or GI symptoms associated with it, they may do better with the injectable form. Corticosteroids are a rescue medication that we use as immunologists and as physicians. This is like prednisone, dexamethasone, Medrol dose pack. These medications help bring down inflammation fast. They're like fire extinguishers for a really bad flare. The problem is that they are not great long-term medications. Long-term use of corticosteroids can thin your bones, cause osteoporosis, which we're already at a higher risk of this if we have autoimmune disease. They're best used short-term. They can also change our appetite, make us much more hungry, change our metabolism where we're apt to put on weight, retain fluid, increase our blood pressure, blood sugar, and can change our mood too. So you have to work very closely with your doctor to weigh the pros and the cons of when a short course of corticosteroids may be really crucial in putting out the fire temporarily, but working on a long-term solution to help minimize the need for these medications. Rituximab is a medication that is reserved for the more severe cases of Sjogren's disease, and more often will be used for people who have significant lymph node involvement or nervous system involvement, and a few other significant complications related to their Sjogren's disease. Rituximab helps by depleting overactive B cells. B cells are immune system cells that create antibodies, and they are the cells that are creating that response to our own tissues. It's a medication that's given through an IV intravenously. And there are some folks who will experience an infusion reaction, though most often patients will receive a dose of antihistamine like diphenhydramine or Benadryl and some corticosteroid as pre-treatment to try to prevent this. Rituximab is quite immune suppressive. It essentially is wiping out that part of your immune system that's causing a problem, but this also lowers your immune defenses, make it more challenging for your body to mount a defense from a vaccine or against a significant viral or bacterial infection. It's important to be extra vigilant about infection prevention while on rituximab. Sjogren's. It's about the whole you, not just medications. The crucial message I tell all of my patients: your Sjogren's disease treatment plan is more than just the pills and the potions and the eye drops and the mouth sprays. Building your healthcare team is really critical. Sjogren's is a systemic disease, and regular checkups with your healthcare team to ensure that your eyes, your lungs, your gut, your nervous system are all working and functioning well is really critical. Regular checkups with your doctors and specialists aren't just appointments. They're opportunities to build a long-term partnership, especially when it comes to something as complex and unpredictable as Sjogren's disease. Living your healthiest life day by day. It's not about perfection. It's about adding more of those good, healthy habits as you're able to. Moving your body, eating nourishing foods. We'll be talking lots about Sjogren's disease and nutrition in upcoming videos, so stay tuned. And those small but mighty stress-busting strategies that all add up over time. Those frustrating side effects from Sjogren's medications, I get it. I've been there too. As a physician, I use science to guide me, both for my patients and for myself. Staying informed about new treatments, working closely with my doctors, and constantly reevaluating my Sjogren's plan makes me feel like I'm taking charge, and that in itself is pretty empowering. Are you looking for support and connection on your Sjogren's journey? Be sure to join my free Facebook group, The Success with Sjogren's Sisterhood. And if you're looking for more tools and resources, download my free Sjogren's Superhero Starter Kit. It's packed with valuable information to help you navigate your Sjogren's journey with confidence. I'll put the links in the description below. What questions do you have about Sjogren's disease? How about Sjogren's medications? What strategies have helped you manage your side effects? Leave your thoughts in the comments below, and I'll look forward to connecting with you. And don't forget to subscribe for more Sjogren's friendly tips and videos just like this one.